sinus and heterogeneous enhancement post-contrast. What is most likely diagnosed? Inverted papilloma. This is highly vascular, that's why it says heterogeneous enhancement post-contrast administration. It actually is very vascular, so it is fluid it has, and shows heterogeneous enhancement. Another thing is that, if you remember, we read before anterocoinal polyp from antrum to nasal coronal, so anterocoinal polyp. But this is inverted papilloma. It goes from nose, it destroys the lateral of the nose and maxillary side of the nose, and then goes into the antrum. Question number 14. Trigeminal nerve schwannoma was diagnosed. What signal characteristic would be most characteristic on MRI? Isodense to gray matter on T1 weighted images, like a nerve. Now, brain is also composed of nerves, so schwannoma, which is a nerve tumor, trigeminal schwannoma, is also going to be isodense to gray matter on T1 weighted images, like a nerve. Next question number 15. Headache, right side arteria, and associated abducens nerve palsy. CT scan shows apparent of the petrous apex on the symptomatic side and cavernous sinus enhancement. MRI shows low signal mass within the petrous apex, which demonstrated bright peripheral enhancement with contrast. The mass was hyper intense on T2W. What syndrome is the patient most likely suffering from? Chiari-Negro syndrome. Okay, what is Chiari-Negro syndrome? It consists of a triad, aortic media, abducens nerve palsy, and retroorbital pain. Okay, so the patient had headache, arteria, and associated abducens nerve palsy. So he has Chiari-Negro syndrome. What are imaging findings? You have to look at this. Okay, this is T1 post contrast. This is T1. Now we can see that this part is a bit higher coordinating on T1, and on T1 post contrast is more enhancement. So now we're talking about this part. Chiari-Negro syndrome, CT scan shows opacification of the petrous apex on the sympathetic side and cavernous side. Okay. MRI shows low signal mass within the petrous apex, which demonstrates bright peripheral enhancement with contrast. The mass was hyperintense on T2W. This T2W was hyperintense. Most likely patient suffering from Chiari-Negro syndrome. You have to know the anatomy that there is a low signal mass within the petrous apex. Low signal mass within the petrous apex. It demonstrates bright signal enhancement, bright peripheral enhancement with contrast. It is hyperintense on T2W, Chiari-Negro syndrome. Next question number 16. Patient has epistaxis. CT scan shows large mass in the nasopharynx, extending into the petropalatine and impartimental fossa. For in contrast, there was significant enhancement and erosion of the medial petroglyph plate was seen. What treatment would be an appropriate next step in this management? Embolization. This is angiofibroma. Large mass nasopharynx extending the petropalatine fossa and intervertebral fossa. Okay. Then there was significant enhancement, so it is very vascular tumor, and there is also erosion of the petroglyph plate. The treatment would be embolization. It is highly vascular tumor, supposed to be decrease the blood supply. Question number 17. Midline neck swelling, moved with swelling. Ultrasound shows hypoechoic non-vascular lesion. What percentage of these lesions are likely to undergo malignant change? Less than 1%. The diagnosis of thyloglossal cyst. So what percent can undergo malignant change? Less than 1%. Question number 18. Lower to the left mid-maxillary region, fractured segment that has a pyramidal shape. What type of fracture is this? L4-2. Pyramidal shape, L4-2. Pyramidal shape, L4-2. Let's go next one. Question 19. This is also a simple clinical diagnosis question. It's easy. Bilateral external ear masses. There is build-up of layer of flaky skin, and patient has chronic sinusitis and bronchiectasis. Most likely diagnosed keratosis obstruans. When in the MCQ comes that build-up of layers of flaky skin, then this is keratocystic layers. So build-up of layers of flaky skin, diagnosis keratosis obstruans. Build up of layers of flaky skin, diagnosis keratosis obstruans. Question 20. Unilateral enlarged orbit, X-ray shows opacification of the maxillary sinus with low air fluid level. The scan shows depression of the right orbital floor with enlargement of the orbit and the lateral displacement of the lateral wall of the nasal fossa. The middle terminate was enlarged but morphologically normal. What is most likely diagnosis? Sinus hyperplasia. Okay, this is also from the MCQ. We see that unilaterally there's enlarged orbit. With this, we have to diagnose from the question. X-ray shows opacification of the maxillary sinus with no air fluid level. There is opacification of the maxillary sinus with no air fluid level, and CT scan shows depression of the right orbital floor with enlargement of the orbit and lateral displacement of the lateral wall of the nasal fossa. The middle turbinate was large but morphologically normal, where most likely diagnosed sinus hypoplasia. No other option makes sense, and over here they tell you that there is opacification of the maxillary sinus with no air fluid level. So if there are air fluid level, then it means sinusitis, but there's complete opacification, so it's most likely sinus hypoplasia. Now in sinusitis, there's air fluid level, and in teratitis, there will be it is seen in teeth. The other options, there will be sinusitis, but it cannot be sinusitis answered because there is no air fluid level, and there cannot be also dendritic cyst answered because dendritic cyst occurs with unerupted tooth, so most likely diagnosed as sinus hypoplasia. Also here it says that complete opacification of the maxillary sinus with no air fluid level. Next question number 21. Next X-ray, there is loss of the normal subglottic angle resulting in wide bottom shape appearance on AP projection. Loss of the normal subglottic angle resulting in wide bottle shape appearance on AP projection. On the lateral film, ill-defined haziness of the soft tissue air interface between the glottic and subglottic region. What is most likely diagnosis? Group. Subglottic is croup, and epiglottis is supraglottic. This is epiglottitis. It occurs in the supraglottic region. Again, this is X-ray. There is loss of normal subglottic angle resulting in a wine bottle shape appearance on AP projection, or sepal signs. Sepal diagnosis, croup. And supraglottic obstruction is epiglottitis. Question number 22. You are considering the utility of a CT scan in detecting oncologic neuromas and read a study evaluating its use in 200 people of whom 10 actually had the condition. The study reports that CT was reported as abnormal in 7 patients and there are 188 true negatives. What is the sensitivity of CT for detection of oncologic neuroma in this study? 50%. There are only very few MCQs requiring calculation. If you can calculate it, it's okay. Otherwise, you can memorize the answer, but it's not so difficult. That CT scan detecting oncologic neuroma and it's used in 200 people of 10 people actually had the condition. The study reports that CT scan was reported abnormal in 7 patients and there are 188 true negative. What is the sensitivity of CT scan? For 50%, 22. Okay, so apply these uh, formulas and then solve it yourself. This is easy MCQ. What is memorized answer? What is the sensitivity for detection of oncologic neuroma? 50%. What is the sensitivity of CT for detection of oncologic neuroma? Say 50%. Question number 23. At which of the following anatomical sites are you least likely to find mal-descended thyroid tissue within foramen lacerum? Because foramen lacerum transmits internal carotid artery. So mal-descended thyroid tissue is very less likely to be in with foramen lacerum. And it doesn't come, thyroid tissue goes through the midline of the neck. So foramen lacerum does not come in the midline of the neck. It may be in the foramen caecum, maybe in the tongue, maybe in the midline of the neck, but it cannot be in the foramen lacerum because foramen lacerum transmits internal carotid artery. Question number 24. 4-year-old girl has 16 kg weight, mass in the posterior fossa, post-contrast scan is being planned. How much 300 mg per milliliter intra iohexol non-ionic contrast will be appropriate? 32 ml. How do you calculate this? 2 ml per kg, so 16 kg weight, so 2 ml multiplied by 16 is equal to 32 ml is the appropriate. Question number 25. MRI with prominent occipital horn and a high riding third ventricle were seen. Sagittal section revealed a radial orientation of the gyri. What is the most likely diagnosis? Corpus callosum agenesis. Okay, this is corpus callosum agenesis, corpus callosal lipoma, corpus callosum agenesis. Okay, this is corpus callosal lipoma. So okay, wait. We go to corpus callosal agenesis. The prominent MRI shows prominent occipital horns Okay, these are prominent occupied horns of the lateral ventricles on axial section, and higher-ring third ventricle. Higher-ring third ventricle. Sections reveal radial oriented orientation of the gyri. Most likely diagnosis: carpal tunnel agenesis. Okay, when the carpal tunnel is removed, then third ventricle appears that it rises high. Okay, now MRI with prominent occipital horns and high-ring third ventricle on axial section, and on secondary section there's radial orientation of the gyri. The radial orientation of the gyri diagnosis: carpal tunnel agenesis. Question number 26. MRI shows wide CSF composition between the left lateral ventricle and the cortical subarachnoid space. Okay, this is schizencephaly. The poencephaly, the schizencephaly, and this is lissencephaly. In this, there must be a figure 8 sign. Lissencephaly, now we are dealing with, and this is pachycardia. Okay, now we are dealing with schizencephaly. MRI shows wide CSF communication between the left lateral ventricle, or here right.
Excuse me, sir. Tell me the diagnosis of fourth image.
This is the pachycardia. Can you see this? ये ऊपर नजर आ रहा है? Pachycardia.
Where it is?
All these gyri are numerous with pachycardia.
Okay, and third image की diagnosis.
This is lissencephaly. L से lissencephaly.
Okay, sir.
There is schizencephaly and there is poencephaly. Okay, so look how they describe it, that there's a marital wide CSF communication between the lateral ventricle and the cortical subarachnoid space. Similar small communication was seen on the right, most likely schizencephaly. Now here they're talking about the CSF communication, but in front MCQ will come and will say that there's a defect in the gray matter. जब वो आएगा तो हम देखेंगे, ठीक है। फिलहाल ये किस तरह डिस्क्राइब करें, चाहे CSF कम्युनिकेशन बताओ डिस्क्राइब करो डॉक्स में, या चाहे डिफेक्ट ऑफ ग्रे मैटर बताए, वो दोनों ठीक है। अच्छा, फिलहाल जब वो MCQ आएगा तो हम देखेंगे MRI shows CSF communication between the left lateral ventricle and the cortex subarachnoid space, ठीक है। Schizencephaly diagnosis. Question number 27. Suggestive heterotopia. What are the likely findings on the MRI? Okay, heterotopia. What are the likely findings on MRI? Bilateral nodules of ependymal gray matter. Okay, this has a mechanism. Heterotopia, when it's formed in cerebral heterotopia, is due to arrest of migrating neuroblast from ventricle to gray matter during development of the brain. So this you have to understand that bilateral nodules of ependymal gray matter is seen in heterotopia. Remember like this, that the gray matter has not yet developed, so it is appeared as bilateral small nodule, is yet developing. This you have to memorize this, because this has a, it is due to the arrest of migrating neuroblast from ventricle to gray matter. Suggestive heterotopia, bilateral nodular subependymal gray matter. Heterotopia consists of bilateral nodular subependymal gray matter. Question number 28. Okay, hairy patch. Okay, see the spinal cord, it is divided into two. So also here the spinal cord is divided into two. So this is diastematomyelia. Now, hairy patch overlying the lumbosacral region. Usually the child presents with a lumbar meningocele. Hairy patch overlying the lumbosacral region. MRI shows bony cleft within the spinal canal and two hemichords from T11 to L1 for most likely diagnosis. Diastematomyelia. MRI shows bony cleft within the spinal cord and two hemichords from two hemichords. Bony diagnosis